Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone living with my own chronic pain for over 30 years. I've also been working professionally with other people living with chronic pain for over 29 years now. What I've noticed during that time is many of the people I've worked with have also experienced other problems besides chronic pain. They have a lot of psychological problems up to and including addiction. One of the most common co-occurring problems for people living with chronic pain is depression. Living with debilitating chronic pain 24/7, day in, day out for months or years can really drive people down. Many people get to a hopeless and helpless state. Some of them actually do, though, develop the real clinical depression. One of the first things I do when I work with people is I do a full assessment at our first session. I want to see what exactly is happening. One of the instruments I use is the Beck Depression Inventory. It's been around for a long time, it's very research-based, and it really gives me some good diagnostic information in 27 different categories. And I really love using this instrument because it helps me develop a treatment plan. I have people work on non-medication based plans first. If someone only has minor to moderate depression, it's probably not a good idea to jump right to antidepressants. However, if someone has moderate to severe depression and the cognitive behavioral, changing thinking and feeling and behaving skills don't work for the person, then the research is really clear that the best approach is a combination of antidepressants and cognitive behavioral therapy working together. There's many things besides medication, though, that people can be doing. Exercise, big, important piece of a depression management plan. Unfortunately, the disease of depression tells people, I can't do it, I don't have enough energy. And that's the paradox, because once they do get out and do it, they'll find they have more energy. But it's helping them develop a step-by-step plan that I've found very effective. The other part is to help them with a good diet and nutrition plan. Some people with depression overeat, some people with depression undereat. Helping them develop an appropriate and healthy meal planning schedule is also an important part. Sometimes I'll refer them to a nutritionist, or I'll send them to different websites that I use sometimes to help people with meal planning, to help them with that. Then the next part is the social piece. Many people with chronic pain end up isolating. When they have depression, the isolation even worsens. So I want them to start getting out more. I want to help them start looking for tools to interact with other people. For example, some people might want to join a church group. Other people might want to start with some online support groups. ChronicPainAnonymous.org is a really great group for people. It's free. It's ran and supported by people who are living with their own chronic pain or chronic illness and disability, and they use a very spiritual 12-step approach to chronic pain management. They have different ways people can interact. They have phone meetings. You go onto their website at chronicpainanonymous.org and you click on the meeting tab. And then you'll see there's two different types of meetings. There's the phone meetings, and for the phone meetings there's different types. And the other type is you can join the topic discussion group through email. And every couple of weeks they change the topic. People from all over the United States and Canada start talking about how they're living with their chronic pain one day at a time and giving each other hope. A big thing for depression management is to develop some hope. One of the things I want to help people identify is, what are your depression thoughts? What is your head telling to you? And don't believe everything that goes on between your ears, because most of it's just not true. Helping them challenge self-defeating thinking patterns is really crucial, and I like to shift people into an attitude of gratitude. So helping people develop a gratitude list every day is a big part of a depression management plan for some people. Whatever it is, you don't have to suffer with debilitating depression. It only makes the chronic pain worse. It's a vicious cycle. I believe that freedom from suffering is everyone's right. It's also a responsibility. So be responsible. Learn as much as you can about depression. And after you've watched this video, check out the text and read some more about how to look at identifying and managing clinical depression for more effective chronic pain management. Thank you.